So, the industry has a very common process called utilization management or prior authorization today, right? So, what happens today is, to the extent that the available information is there when a member goes to a provider or a doctor, and it can be approved, it can get approved. But many times, what happens is that there's a lot of back and forth between the insurer or the risk bearing entity and the health system or provider or the doctor's office, and for getting an approval before the service could be performed, right? So what happens is they send either fax or sometimes electronic, but many times fax is still, that's reviewed by a clinician or a medical director, and they have to match eligibility requirements. They have to understand if the benefit is covered. Then they have to look at medical necessity to apply guidelines, like evidence-based guidelines, to see if this is actually necessary care. Because a lot of times the care that's being administered is unnecessary and it creates more complication, more spend. And so they have to go through the decisioning on that. And then when you go through that, there may be information from the medical record that's missing, right? That is required to, then they reach out to the provider's office, and many times there's not, like, sometimes maybe there's connectivity with the EHR that you can message them electronically. Otherwise, somebody has to call the doctor's office, and the doctor's office, because they're in the middle of looking at somebody else, so they're not able to answer them, so they have to return the call. Then you get the missing information, you have to go through the process to redo the workflow, so it takes time, it adds administrative burden, and meanwhile the patient or the member is waiting for all this. Look at now what AI can do, right? It's not just these kind of like very straight through scenarios, all these complex scenarios with peer reviews and data going back and forth and reviews that need to happen. At when you look at this end to end process, what we are able to show is that bringing in 40 agents, not one or two, 40 agents working on behalf of one clinician, they can streamline all of this, right? And when they do this, when the AI is working in tandem with the human, with a lot of responsible AI layers built in, the human is still getting, so they're reading the document, surfacing the first summary. They're saying whether it's eligible or not. They're saying whether its benefits covered or not. They're already applying the clinical criteria guideline to suggest what might be the. They're saying here's the missing information. They're actually fetching the missing information from the EHR and doing the redetermination on the fly. They're notifying the it's end to end, right? So all these edge scenarios, when 40 agents can work on behalf of a clinician, it gives an enormous lift to the clinicians, right? So it's, the question is not about um, how do you really replace the clinicians. The question is about how do you give relief to the clinicians, right? And with all this administrative work that's happening, so they can actually apply it to either counseling or looking at care guidelines and accepting and practice at the highest of their license, right? So that is Dimitri, that workflow I just described is 80 to 90% more efficient, and the turnaround times improve by like multifold, and the patient gets what they need right away. That's the
Yeah, I think
kind of
that's
thing
really
we need to
important.
embed.
I think that's really important to call out. That percentage, one, crazy. Very good.